everyone, my name is Matt Viegas. I'm a current DPT student, Doctor of Physical Therapy program. It's a 3-year program, and just reflecting on my experience last year at CSM 2016. So I already talked this year about, when it was February, about my experience from this year's Combined Sections meeting, and basically it's an annual National Physical Therapy Conference. It's pretty interesting. This instance, CSM 2016, it was in Anaheim, California, which was awesome because I'm from California. I'm from the Bay Area, went to college at UC Irvine, so I was obviously familiar with the area, and it was great seeing these familiar faces when I had just gone through the roughest time ever in school. So I'm going to talk about that really quick because that sort of sets up the context. Basically, during the holiday season, there's always that difficulty with college or any, higher level education program. And then going from there, I had this really crazy experience with just 3 weeks and 9 exams within that span of time across 7 courses, and basically being in class from 8 to 5 every day and dealing with that during my first year. So doing that during the holiday season, and then getting towards the end right before CSM with finals weeks. And with finals, everything was cumulative, so it was a huge blur, but the nice thing was not having that 8 to 5 with class all the time. So that's sort of the story and the context and like the mindset I was in just as a first year, feeling like I had everything tossed at me, and then going to Anaheim, California, to this conference, and then finally, being really nervous and not feeling like I was confident with everything, even though I did pretty well with my coursework, and just trying to network, trying to, see things to do, see things that I was interested in. And I had spoken with my professors prior to going to develop some type of plan for what I should do. And, it's my first time just go out there and explore. And it was really interesting because since it was in California and I'm from California, I did see familiar faces. I know it was nice. And since it's within driving distance, it's like 4 hours away from Las Vegas area, which is where I'm at right now. A lot of my classmates went as well. So 4 of us from the first year, and definitely a lot from the second year cohort when I went this time in 2016. So it was interesting, it was fun, and really getting a feel for just how the event works. And going through these different talks, just looking at a list and saying like, oh, that sounds interesting, these different sections. So basically with physical therapy, it's more systems oriented, like your heart, cardio, your brain, nerves, neurology, and of course muscle and bone, ortho, and different population types, pediatrics with children, geriatrics with older population, and feeling out these different seminars. So I went to 4 total because my brain was still fried from having done all this studying and what felt like it was pretty much kind of like cramming, even though I was learning and I've still retained a lot of it. I'm just going through and trying to go in with an open mind and this belief that even though I'm a first year, just pay attention and then see what I could get from it. But it was interesting going into these different talks, and just some things didn't really line up with where I expected them to be. But for me personally, because I have a brachial plexus injury, I went to a talk on a brachial plexopathy. It's more about direct access and more related with the military. So of course with trauma and later onset, whereas for me it's onset from birth. And being able to review the brachial plexus, which was still fresh in my mind from anatomy the term before, and seeing this different way that data is presented with electromyography and using a needle to stick into the muscle and get this data, and having these tables and learning the terms of like CMAPs and SNAPs, basically the difference between motor and muscle or sensory, what you would feel, and just relaying that with the clinical case, trying to fit everything with the history, and getting this mindset of real PTs and what real PTs don't know, because with combined sections meeting, with these conferences, for people who are licensed and practicing clinicians, these count towards CEUs, continuing education units. So this is stuff that some people don't even know, even though they're licensed. So I was trying to get as much as I could and just get a really good idea for how people spoke and just soak in as much as I could. Unfortunately, one of the disappointing ones was regarding running. Initially, the talk was okay, and of course, I love running. I spoke last week about running a marathon. I've done a lot of work with cross country and track and field, and just trying to improve my game, because I had learned about gait analysis, but not in the sense of running with a flight phase and whatnot. And you can look up more about that. But with running, that talk just, I gotta say, and unfortunately this is a very common theme with these conferences, that it was pretty boring, cut and dry, because it was focused on the research and the presenter wasn't that engaging. It didn't have to be like super entertaining or anything, but just like monotone and boring, especially for me being a student and having been in a classroom and paying for this experience and trying to get the most out of it. But basically, from that, what I took was like using iPads and just trying this different way to record a video with gait analysis, that we have something to refer back to and show the patient what you are looking at and what you're seeing. One of the coolest talks, though, I'm just going to jump straight into it. Coda Reichert, one of my Facebook friends, my older brother's friend from cross country back in my hometown, in Alameda, and his presentation on bone and blood marrow transplant. Out of all the talks, of course, I'm biased, that was engaging. I actually found out about that one the day of, because I looked in my Facebook feed and saw that he posted a picture that he was doing a talk. So I had really, really wanted to check out a PEDS talk about premature infants. Honestly, all of the good stuff was saved towards the end. And I decided to, be loyal, show my support, and it turned out to be much better than I expected. Basically, what he was doing was reviewing the physiology and the terms, stuff that was fresh in my mind about, bone and blood marrow, a little bit about the osteology and the physiology, and of course the oncology, like cancer, right? And how it is working with these patients, some of the things that you wouldn't expect, especially if you're not working in that setting. So for that, like, my main takeaway, especially watching him, was just how he answered questions, and he was very on point, very poignant, and encouraging discussion, healthy discussion amongst professionals, not about egos or anything, and really focusing on improving ourselves as clinicians to improve patient care. And this was a really interesting one for me, because I didn't even have it occur in my mind. I wouldn't have gone to any of the talks about oncology, PT, rehab, if I hadn't known that Coda was doing that talk. So it was something interesting. Overall, with the event, I really enjoyed checking out the different sections, looking at booths, seeing familiar faces, because it was in California, and that was like really something I needed after going through the roughest term. Definitely one of the roughest points in my life, at least academically. And being able to meet people, being able to check out booths and stuff. And I'd say as a student, especially as a first year student, it was great to see these different clinics, locations, like stuff that's out there. And I mean, it was nice for me to get like, freebies and whatnot, especially with the Christopher Reeves Foundation, their huge booklet on spinal cord injury, which was something that I found interesting learning about, having just covered neuroscience and learning about nerves and all of that stuff. But basically, I just want to sum it up there, go over my experience. As a first year, it was so nerve wracking because all the information is fresh in my mind, and I hadn't really like condensed it, thought about it, reflected on it. But it was nice being able to be amongst licensed PTs, see what the research is out there, and hearing the discussions in terms from real people that are working with patients, which is where I'm going to be. So I hope that provides some value for you if you're watching, and I hope even if you're not a PT, at least with the networking aspect, being encouraged to really step outside of your comfort zone, even when everything that you feel seems to resist and go against that, and you're just going through, one of the roughest times. But all right, that'll be it for this week, and next week I'm actually doing a really big special talk. I'm going to do what's called a BeLive.tv interview. I've done one before on this channel with Tyler Tracy, another student physical therapist. He graduated, by the way. I'm going to be doing a talk next week with Greg Todd. So he's a really big name PT in the field. Going to be a great interview. If you have any questions, you can certainly message me. I'll try to include stuff during that talk and prep things that I have. Basically, we're going to cover his story and just what it is that he's doing that's so vastly different from what's going on in the healthcare field with physical therapy right now, and what you could hopefully gain from that. All right, so stay tuned next week. Thank you for watching and have a good one. Adios.